Please note, the opinions expressed in this podcast are those of the individual speakers and do not necessarily reflect the views of Tri-County Orthopedics. Any medical advice or treatment recommendations discussed should always be reviewed with your own healthcare provider. This podcast is not a substitute for professional medical advice, diagnosis, or treatment.
Welcome back to the OrthoZone podcast, brought to you by Tri-County Orthopedics. Today we are so excited to have Dr. Paul Lombardi and his nurse practitioner, Christine Baumann, on the podcast. We have been compiling all of the questions we have gotten over the last year on our operating room videos, and we are going to answer all of those questions today. The Q&A is going to be split into two parts, so today is just part one, and then tune back in next Wednesday for part two. Welcome, Dr. Lombardi and Christine.
Thanks for having us.
Yeah, hi, how are you?
First question, why do you wear a hood in the OR?
So the surgical hood serves two purposes. It actually protects the patient from an infection from me, and it also protects the surgeon from any splatter of blood or any tissue. So it really serves two purposes.
So we get comments like, are they going to space? It looks like you work in a bomb unit. And a lot of people assume that the patient that you're operating on is infectious. We get people saying, does this patient have Ebola? So
Pretty much the standard of care, right? I mean,
Yeah.
I think you said like most of the data is like 50-50, but you know, whether or not to wear the hood in surgery. But when it comes down to it, if somebody has an infection, that's the first thing they're going to say, did you wear a hood?
Yeah.
So it's really just all for protection. It protects me standing there and it protects them laying there.
And it's not for Ebola reasons. We're not going into space. But certainly, this is a long-standing practice now that's been present for about 40 years now.
You know how you go to a hockey game and the puck flies off the ice and it says on the back of the ticket, things may fly off. It's the same thing. Things may fly off the field in surgeries. We have to be protected.
why do you wear two sets of gloves?
Ooh, that's a good one. Okay, so double gloving is actually an AORN standard. The American Academy of Operating Room Nurses. And it's for two reasons. One is because if I got contaminated, it very quickly I can just remove the outer glove and I still have a sterile hand. The other thing is if you get a hole in your glove, it doesn't go through to the second glove. And a lot of the times the second glove is a different color. You'll see different colors getting donned on a practitioner. And that's like an indicator. So if there's a hole in the glove, then the green shines through or the brown shines through and you know you have to change it.
Yeah, I would say that double gloving allows me to understand my own fluid status. So I've had a lot of Chinese food the night before. Double gloves.
It's true. It's true.
The double gloving is more tight on my hands.
If you have margaritas,
Whereas
they're very
if
salty.
I'm a little dehydrated, then the
They
double
slide
gloving
right
is a
on.
little loose. So,
True.
Yeah.
Very true.
Another question that we got a lot, which is in response to Dr. Dundon's video, is why does he wear 3 pairs of gloves?
So he does that so that when he's done draping the patient, he then removes that outer third glove and then he's really just double gloved. Instead, a lot of surgeons, sometimes you wear the double gloves, you drape the patient, and then you change the outer gloves. So he's just kind of what he feels saving that step. So he just pulls it off and doesn't have to worry about contamination. It's all about sterility.
Why do you scrub your hands just to put gloves on?
So the actual rules for scrubbing is your first scrub of the day should be your most rigorous scrub, up to 5 minutes, and you should clean your fingernails. And then during the course of the day, if you don't do anything significant to contaminate your hands, such as grab a roast beef sandwich,
Right, go have lunch.
or go have lunch, or something
Brush your hair.
or the obvious,
Right.
then you could actually use that alcohol solution where you don't have to scrub. But the minute you actually do contaminate your hands, you should go back to scrubbing again.
There are lots of standards on that, and it changes often because sometimes they would say 5 minutes. I think then it went down to 3 minutes.
And also on the videos where we're scrubbing, those are abbreviated so that you may not see the full technique on those videos.
I don't like the Avogard, like the gel.
Yeah.
I feel like you get slimy at the end of the day. I much rather just use the soap and water. So some people have preference. Yeah.
Is your dexterity or tactile sensitivity impacted by the gloves?
Yes, so there's different types. I wear the thinnest gloves possible, so I do have tactile sense, but there are gloves that are extremely thick, meant more for protection, that I choose not to wear, but some nursing staff wears because they're obviously not involved directly in surgical care.
So one time I gave a pair to my husband, who's a mechanic, and he was like, these gloves are amazing. I can feel everything, because whatever gloves he was using, I guess, were whatever thick. And he's like, this is so great. I'm like, yeah, well, they're surgeon's gloves.
There you go.
How come when the scrub nurse is tying the gown in the back, they don't wear gloves?
That is not a scrub nurse. That is a circulating nurse. Again, here's your AORN standard. There has to be an RN in the room. Usually it's the circulator. They are not sterile. And nothing's sterile in the back because the idea is whatever you can see is sterile. So clearly behind you it's not. However, the gowns that orthopods use, they're called sterile backs. So there's actually a way that you can close the gown without touching it. So they do not need gloves. There's nothing back there that's dirty.
Are you required to keep your nails cut short?
Again, AORN standard, yes, they should be short. There was some published article at some point that talked about longer nails and, harboring bacteria. The other thing is there's a lot of standards for, no gels and, nail polish should not be chipping, that kind of thing. So yeah, hygiene. I picked the wrong profession, by the way. I love nails and jewelry and hair. And when you're in the OR, it's none of it.
So someone asks, isn't the sink water not sterile?
So that is actually a very good point. The sink water is not sterile. So what we're looking to do is basically get our hands as sterile as possible so that we don't pass any infections on to the patient. But that is an absolutely excellent observation. The water is just like the water coming out of your tap in your kitchen.
It's not holy water.
It's not holy water. That's correct. So we're just trying to get as sterile as possible. And that's why there is multiple layers of sterility. So we have the scrub, and then we do the double gloves. Okay, so that's the reason why we use gloves in the first place, right? Because we do want some level of sterilization between our hands and the patient.
Oh, I always think of an infection like links on a chain. Anywhere that you can go and break a link is a good way to prevent infection, right? So washing our hands is preventing a link. Putting the gloves on, giving an antibiotic, making sure everybody's draped. So anywhere that you can try to prevent a link from being made, so breaking the links of infection is like washing your hands, using a hood, gloves, anything else that you can do. A patient has a scrub that they have to do at home prior to coming in.
This question gets asked over and over and over again. So once you're scrubbed, having all of that PPE on, is it a sensory nightmare?
It depends. Sometimes when I have the helmet on, so let's say I have a cold or a stuffy nose.
Well, that doesn't work well in the OR ever.
But certainly when you have a helmet on, you can feel a little more claustrophobic, like you want to scratch your nose but you can't. But otherwise, after so many years of it, you kind of get used to it.
Yeah, but I get it because when you think about it, you have a skull cap on.
Yeah.
And then some people wear glasses, and then you have the helmet on. There's a fan in that helmet, and then there's a hood on it. Like the last thing I need is something else on my face. Yes.
So what's kind of interesting, I don't know if it's interesting, but I don't know if you've ever seen the movie Mars Attacks, when the Martian has the helmet on and then his brain explodes and into this green goo goes all through the helmet. That's what it feels like when you sneeze in one of the helmets. It doesn't actually happen, but you feel like it.
Well, there's certain people that we work with that spray when they talk.
Yeah.
So actually I enjoy the hoods because then I know that when normally I'm with that person, I should probably step back a couple more feet.
And actually the technique, so let's say I did not have a helmet on, I just had a surgical mask. If you do have to sneeze in the operating room, you're not supposed to turn your head away. Because what happens is the particles, the droplets go out the sides, not out the front, because you have a mask on. So when you do sneeze in the operating room, you're not supposed to turn away from the field, because that's when you actually do put particles into the field.
What happens if your nose itches or you sneeze or you have to use the bathroom?
So if you have to use the bathroom, then you have to use the bathroom. That's something that you would pick a easy time in the surgery to go do that. Most surgeries that we do are around a half hour, so maybe you could just kind of hold it. But if you got to go, right?
Things happen sometimes. You have to be prepared, right? But that's the other thing. We know those things, right? So we try to do all of that stuff before you get all gowned in gloves so that it's not. But emergencies happen. Then you have to break, you have to step away, you have to break. There's nothing you can do about it. Sometimes you can get somebody else to come in. The surgeon is not really so much, but...
And if I don't have a helmet on, just a standard surgical mask, you can actually ask the circulator to scratch your nose through the mask, right?
No.
Because the mask isn't... Well, you may not want it. You may not want to scratch my nose. But technically you can, because the mask is not considered sterile. So if I had a really bad itch, then the circulating nurse has to kind of suck it up and scratch my nose.
So that's back to that circulator who's not sterile. There's tons of things. As a circulator, they're like, could you get my phone out of my pocket? Okay, really? Same thing. You have to, could you scratch my nose? Could you feed me a mint? Could you give me a piece of gum? There's all sorts of stories.
Well, actually, Christine, you just mentioned something, so why don't you talk about it? It's
So
okay.
it's funny. So
It's PG. It's PG.
It's PG. So
It's
scrubs
PG-13.
are funny
It's okay.
things. I don't know if anybody out there's really ever worn scrubs, but they're not, they're basically, it's a box that somebody puts a string through. So there's no like shape to it, right? So sometimes people that have different body habituses have a hard time keeping them up.
Okay, so let's cut to the chase. We're talking about surgeons who are a little more on the healthy side, we'll say. Go ahead.
Yeah, they have a lot of stuff, right?
Good. Stuff. Yes.
In the center area, so they have a hard time. So like maybe in normal life they would need suspenders, but
Or belt.
or a belt, right? And scrubs are not so much like that. So sometimes during long cases, those doctors or surgeons, their pants fall down, but they're covered because they're in the surgical gown, but their scrubs end up down around their ankles. This is like a known thing, and the circulator nurse has to go usually. It depends on who you know. Some people just say just leave it. Some doctors step out of it. Yeah, that's a well-known thing. You ask OR nurses all over the place. My favorite one is back in the day when there were pagers. That was my favorite. I always had a hand surgeon that I worked with, and his pager was always kind of like on his back belt, and he was always sitting, and he'd say to me, Christine, my pager's going off. Could you grab it and look at it? Sure, no problem, And then I was working with another surgeon. It was an orthopedic surgeon as well, but he was standing at the field, and he said, Christine, could you go get my pager? And I was like, sure. So I start to like look for it around his waist, and he was like, what are you doing? My pager's over there, and it was over on the table in the corner, and I was like, oh, I'm so sorry, because the other surgeon had always kept it on his belt, so that was funny.
Okay, let's call the HR department.
Yeah.
Who scrubs in the people who scrub you in? Meaning, who scrubs in the scrub
The
nurse?
scrub tech or the scrub nurse.
There's a technique.
There's a technique for it. There's absolutely. So what they want to do, or what they do, is they take their gown and the hood, and it's off the field, so it's not on the sterile field, but it's on its own little mini sterile field. And they can dress themselves. There's a way to do it so that they're not contaminating the outer parts. And then the circulating nurse that's in the room will tie them up just the same.
So I actually will confess something during this podcast. When doctors look in the room and see that scrub tech struggling to get dressed, the ones that we like, that are nice to us, we go in and we help them. But the ones that are really kind of mean to us, we let them struggle. But that's just a little...
And then
I'll
they turn
confess
around
it.
and what do? They snap your gloves,
That's
right?
true.
When they go to put their gloves on the surgeon, they let them go. So they go snap.
Yeah, so it's like a rubber band on,
Yeah.
on our wrists.
Yep. So if
They
you're
don't
kind of
like-
mad,
Yes.
yeah.
Do you need to wear a mask into the OR even though you're going to be putting a hood on?
That's a great question. And there's two different trains of thought on it. Some say yes, some say no. I think AORN does say that you should, but that it can come right off once the hood is on.
So having done this for many years, that can be somewhat cumbersome to have the mask on and then off once the hood comes on. So I generally do not use a mask, but I don't talk. So I allow myself not to talk, so I'm not spraying any particles until the hood goes on.
A lot of people asked this one. How do you breathe in the hood, and how do you keep cool in the hood?
So with the hood, there's actually a battery pack that powers a circulating fan that allows cool, fresh air to circulate. And you actually have an adjustment to go up or down. However, there are times in a case when the battery runs out and you call out to the circulator, could you please change my battery? And sometimes, depending where the batteries are in the operating room, that could take some time, and you're basically breathing your own carbon dioxide for a couple of minutes. So those moments could be a little, and then the hood fogs up.
Fogs up, right.
And then once they plug in the new battery, it clears up. But yes, there are times when you're breathing your own carbon dioxide for a few minutes. It's not pleasant, but it's not that bad.
You usually have an alert, there's lights on the inside of the helmet that you can see. So a red light will start blinking, sometimes an orange light, to let you know the battery's going low. So you could try to ask your circulator before it's like, wow, completely red.
Why do you guys spin after you're all dressed?
That's how you tie up. That's how a circulator ties you up. It's so that you close off that back portion where the circulator started the way to tie you up. So that's a big thing that we all say, tell me something that you say that I know you work in the OR, but don't tell me you work in the OR. Tie me up. Yeah.
And I must say, after 26 years of practice, I've developed my own panache when it comes to my spin. Kind of like Fred Astaire.
Do you spin? I don't even think you really spin.
I spin a little bit. I have
A little bit.
So surgeons, as you get more experience, you develop your own little sort of like spinning routine, kind of like, like a little dance routine.
I feel like Dundon, he really spins, like on his heel. Like, whoosh. I can't spin that much. I usually kind of like to just kind of grab the tag that comes around.
Have you ever fallen over doing the spin?
I have never fallen over during the spin. That is correct.
We've gotten hundreds of people asking this question. Preface, a lot of these videos are taken at a surgery center that is on the second floor of a building, so that is why the OR has windows. But how do you feel having an OR that has windows, and do you prefer having an OR?
Oh my gosh, absolutely. I don't know if most people know that most of the times ORs are in the dungeon of a hospital. It's usually in the very bottom. There's usually no windows. You have no idea what happens between 7 a.m. and 7 p.m. till you go back out to your car. That could be 5 feet of snow. It could be flooded. You have no idea. So it's kind of refreshing to go in and that you have windows like that. If ORs are on the first floor and have windows, usually they're one way. They're usually fogged. I like it.
Yeah, the windows in our ambulatory center, they're actually blocked, so you can't see in. The first time I actually did operate in an OR with windows, I was a little apprehensive thinking that it would be a distraction. But after a while, it really is not, and it does serve to add a new energy into the room that's actually quite refreshing.
I remember doing a knee with you and the sunlight came in.
Yeah.
And it was so nice to do surgery and have sunlight. Like it was just, like you said, it was just really cool.
And like you said, no one can see into the windows.
No one can see in.
Unless you're a bird on the tree outside.
This is for Christine. What type of nurse practitioner are you that enables you to scrub in?
I have my RNFA as well, which is an RN First Assist. It's a certification. Most NPs you don't see in the operating room. That's something that maybe a surgeon like Dr. Lombardi has, that was particular for his team. That was the way he wanted to create his team.
If you enjoyed today's episode, be sure to subscribe so you never miss an update. Don't forget to share the podcast with others who might find it helpful, and follow us on Facebook and Instagram at Tri-County Orthopedics to stay connected. Thanks again for tuning in, and we'll catch you next time.